Hi, my name's Alicia. I'm going to be your nurse practitioner student today. Can you tell me your name and date of birth?
Dave Greenwell, November 4th, 1993.
Okay, and what would you like to go by?
Dave, it's fine.
Okay, is it okay if I do your physical assessment?
It's fine.
Okay, I'm going to have you start by taking your shirt off, please. Alright, I'm inspecting his skin. There is no obvious lesions or masses. Now I'm going to palpate his skin. It is dry. He's got good skin turgor, so he's well hydrated. Okay, now I'm going to move on to, let's see, your hair. I see his hair, it's got good quantity, even distribution. I don't see any infestation, good hygiene. Now I'm going to look at his nails. We've got, okay, nails are even contour, there's no clubbing, and he's got brisk cap refill. Okay, now I'm going to look at your head. I'm inspecting, I don't see any deformities or masses. And I want to now palpate his head. If you could just tell me if any of this is tender. Any tenderness?
No.
Okay, I didn't feel any masses or deformities. Looking in his hair, I don't see any noticeable inflammation. Now next I want to look at his eyes. I'm going to start with the Rosenbaum test. I'm going to hold this a little bit in front of you. If you could just tell me the lowest number of lowest line of numbers that you can see with with the index card over one of your eyes.
Okay. 4, 2, 6, 7, 3, 9.
Okay, now do the other eye.
4, 2, 6, 7, 3, 9.
Okay, based on this, you have got 20/20 vision. Okay, now I'm going to inspect his extraocular structures. I'm actually going to use my hands here and look at your eyelids. Okay, his sclera is white, his conjunctiva is pink, iris is blue, pupils are about 4 millimeters, and his, let's see, I'm going to shine my light here from either side. If you can just look at a point over there, look at that window. Okay. Okay, other side. Okay, he's got the direct and the indirect response, which is an assessment of cranial nerve 3. So now I'm going to stand in front of you, and for the corneal light reflex, I'm just going to shine this in front of your eyes here. If you could just look right at me. Okay, the reflection was in the same spot on both eyes, so he's got cranial nerve 3, 4, and 6 intact. So now I'm going to do the cover and uncover test. So I'm going to cover one eye, and I just want you to look straight at me, and then when I move it to the side, just continue looking at me, okay? Okay, there was no deviation noted. So next I am going to do the test for convergence and accommodation with my finger. So convergence, accommodation, and then just follow my finger. Okay, he's got a good gaze. There's no defects in his lateral gaze, and there's no nystagmus or lid lag noted. So next I'm going to do the static finger wiggle test. With this test, I want you to pretend like you're in a fishbowl, and tell me when you see my fingers wiggling.
Now. Now. Now.
Okay, so he has got no blind spots in his vision, so that is pretty good. So next we are going to move on to the ears. So I'm going to begin by inspecting the outside. I don't see any lesions or masses. Now I'm going to palpate. How did that feel?
It's fine.
Okay, no tenderness. His ears are free of any masses or lesions or deformity. Okay, now I'm going to do the test your hearing. So I'm going to do the whisper word test. If you can just cover up one ear and repeat what I say. I'm going to stand behind you, okay? Yeah.
1, 2, 3.
Okay, now the other ear.
3,
3, 2, 1.
Okay, all right. He's got no hearing impairments. So next I'm going to do the lymph nodes. We've got the, let me know if any of this is tender, okay? Pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, posterior cervical, superficial cervical, deep cervical, infraclavicular, and supraclavicular. Was there any tenderness with that? All right, his lymph nodes that I could palpate were small and soft and non-tender. Okay, so now I'm going to look at his neck. It's symmetric. There's no deformity or distension noted. So I'm going to palpate each carotid artery. Okay, the pulses are strong bilaterally, 2+. Now I'm going to listen with my bell to the upper and the lower. Okay, no bruits noted. So now I'm going to move on to his chest. First I'm going to inspect. I don't see any visible retractions or issues breathing. We've got no deformities with his rib cage or his lung fields. So now I'm going to palpate, okay, and I want you to let me know if anything is tender. Okay, I didn't feel any crepitus or any masses. Okay, so now I'm going to percuss before I auscultate. Start here. Okay, the percussion was resonant all around except for dull in the right lower quadrant over the liver and as well as a little bit over the heart. So now I'm going to auscultate the anterior chest. Take some deep breaths through your mouth for me, okay? I'm going to listen to the lateral. Okay, his lungs were clear bilaterally. So now I'm going to have you swing your legs to the side here so we can look at your side. And I see that his AP to transverse diameter is about 1 to 2, which is normal in size and shape and symmetry. So now I'm going to move my camera here so that we can see his back. Okay. All right. Let's see. Okay. All right. So now I'm going to inspect. There's no deformities or meshes. Now I'm going to palpate or percuss. Actually, if you could cross your arms across your chest and lean slightly forward for me. Okay, all right. Percussion sounded good across all areas. It was a little bit flat over the bony prominences. All right, good. Now I'm going to listen. Take those deep breaths again for me. Again, his posterior chest is clear all around. So if you can swing back towards the front. Move the camera again. Oh, well. Okay, now we're going to do the heart assessment. Okay, I'm inspecting. We've got the right inner space on the right sternal border, the left inner space on the left sternal border, the third and fourth spaces, the fifth, and then the fifth space of the midclavicular line. If I could just have you lean back onto those pillows for me. Let's see how the camera looks. Okay. Okay. Okay, that should be pretty good. All right, so I'm going to auscultate your heart in all of those areas using my diaphragm. We've got the right space, right inner space, the right sternal border, the left inner space on the left sternal border, the third, the fourth, the fifth. We're going to slide on over. Okay. Though I didn't hear any high-pitched sounds, S1, S2 were present. There was no S3 and S4 noises. And now I'm going to do the same with my bell. Third, fourth, fifth. Okay, and I'm actually going to palpate those places, and I would have probably done that before I listened. And I'm going to feel in this fifth intercostal space for the point of maximum intensity. And I feel it right there, and it's strong and even. If I could actually have you turn onto your left side. Okay, so now I'm going to feel it again for the apical pulse. And it is strong and regular. And if you could stay right there, I'm actually going to listen to the tricuspid and the mitral space with my bell. Okay, and I don't hear any murmurs or gallops with that. Okay, and you can go ahead and just turn back on your back and stay laying down. So we're going to look at your abdomen now. So first I'm going to inspect it. It's got a flat contour. I don't see any visible masses or lesions. So now I'm going to listen to it in all four quadrants. The right upper, right for 10 to 15 seconds, right lower for 10 to 15 seconds, left lower, and left upper. And I would do all of that for 10 to 15 seconds. But I did hear his bowel sounds in all four quadrants. So now I'm going to percuss. Okay, it was tympanic throughout, a little dull over the liver here. Alright, now I want you to let me know if any of this is tender, okay? I'm going to palpate lightly and then deeply. Okay, now I'm going to go a little deeper. Okay, I didn't feel any masses or any spots of hardness. Its abdomen assessment is done. So now if I could have you stand up. Okay.
Check how much recording time.
5 minutes left on recording. Okay. So let's come over here. Go stand, walk towards that fridge for me. Okay, now I'm going to have you Let me make sure we can see you. Okay, walk towards me. All right, now turn around and walk away from me, heel to toe. Okay, now turn back around and walk towards me on your tiptoes. And turn back and go on your heels. Okay, now I'm hoping it can see us. Okay, if you'll stay standing and turn around for me. Okay, I'm inspecting his spine. We've got the cervical, thoracic, lumbar, and sacral region. It appears straight and midline. So now I'm going to have you do some range of motion exercises, okay? If you could turn your head to the, look up for flexion, down for extension, lateral movements to the right, to the left, rotate, okay? And now I'm going to have you bend over and try to touch your toes, okay? And then bend, that's flexion, now bend back towards me, lean back into my hands, okay? Now stand up, that's hyperextension. Now if you can turn around and face me, I'll have you raise your arms above your head for extension, and then pull your arms back down across your chest. And then we're going to do abduction and adduction, okay? Okay, next, if I could have you raise your arms out like this, do the bend at the elbows for flexion, extension, supination up, pronation down, and then we're going to do your wrists. We've got adduction and abduction, adduction, abduction. We've got extension, flexion, and then your fingers. We've got flexion, extension, flexion, extension, okay, and then, okay, so that will be all for the musculoskeletal. Okay, so if you could go ahead and come back over here and sit down for me.
Check the recording.
We are close to running out of time, so we're going to have
How much
to
time do I have
restart
left?
the video. A minute.
Okay. I'll
Okay.
just make the same position.
Okay.
Whenever you end it and restart it. You want to just end it and then restart it, and I'll just do the same thing.
Okay. All right, so we've got the neuro exam now. I would like to begin with, actually I'm going to have to stop this and restart because we're running out of video time.